Hey, good evening, everyone, and welcome to the Lackawanna City Council meeting for February 2nd, 2026. Included in this meeting is also the agenda from the last meeting that was canceled because of the inclement, unsafe weather. We will begin the caucus portion of our meeting. As many of you know, the caucus is used by the council members to discuss amongst ourselves the various agenda items, ask questions and get information, so on and so forth. Directly after that, we will go into the formal council meeting. Anyone who is addressing the city council, I would just remind you that there's a sign-up sheet at the podium. You have to sign in first, and that the meeting is being recorded. So the first, going to the agenda, the first several items are administrative. We will skip those. Moving to communications from division department heads, Director of Development and Marketing, Chuck Clark, requests City Council approve supporting resolution declaring New York State pro-housing certification application for the city of Lackawanna. And to that end, Director Clark, do you want to give us some background on this?
Yes, so thank you for that opportunity. The pro-housing certification is a relatively new requirement that that Governor Hochul put into the requirements for qualifying to apply for things like the DRI grant, which can give up to $10 million in development funding, or the New York Forward program, which is for smaller communities in the vicinity of $5 million award. You have to be a pro-housing certified community to even be in the game. So the process involves four major steps. One is a letter of intent from the mayor, which has already been submitted, acknowledged, and is visible on the Homes and Community Renewal website. Homes and Community Renewal is the organization that manages the program. The remaining steps involve the resolution that is before this body this evening. It's more of a templated support document that Homes and Community Renewal requests of all applicants. And then the two most complicated parts are taking our zoning code information and our permit data for the last 5 years and transferring that information into a prescribed template that Homes and Community Renewal requires. It's not as simple as sending a Word document or our own Excel file. We have to transfer the data over. So long and short of it is we're in the process of doing that now, assuming that the body acts positively on the request this evening. We should have everything submitted to Homes and Community Renewal by the end of the day on Friday the 6th, which is coming up this week. And then they're looking at a 60 to 90 day window to review and give feedback. Doesn't necessarily we get approved in that time frame. We may, if the application is really good, which that's my goal. But if not, we'll answer their questions and hopefully be certified soon after.
Thank you, Director Clark. There's a corresponding resolution attached to this correspondence. Any of the city council members have any questions or comments on item number 6?
Once we fulfill this, moving forward, we would be able to declare being a pro-housing city, and that certificate or whatever documentation would be enough to provide any of those funders or grantors.
It allows you to apply. It's by no means a guarantee, but it allows you to apply. And I have not looked this far ahead yet, but I believe there is either a semi-annual or maybe possibly longer renewal process. But again, some of this is contingent upon who the governor will be in future years. But right now, this is part of Governor Hochul's agenda, and as long as she's in office, this criteria will likely be in play.
Okay. And then, not to be a pessimist or anything, but in the event that we're rejected, would they tell us why, and then how we can work towards making sure that we do?
My understanding is yes, they've been wonderful. They being Homes and Community Renewal. There's 2 webinar sessions that are available every week, so I've been on several of them already just to learn how to do what I'm doing. And yes, they will be very clear with you. I do not believe, from everything that I've gathered, that their intent is to deny anybody. They want to put on as many people as they can, many communities as they can. But clearly, if we're deficient on something, they'll tell us. And there's 2 paths, just to not belabor this too much. But if you were a community that had huge new build permit volume. There's one path that gets you to certification. We unfortunately don't have quite that level of home building permit volume, so we are taking the steps that I've outlined here. And so maybe there might be a little bit more give and take on that process than perhaps if we were in the other path. But nonetheless, I don't think their objective is to deny anybody. It's simply a matter of what information they need to get a level of comfort with the certification. Okay?
Any other council members have any questions or comments? Item number 6. Moving on to item number 7, city attorney. Kwiatkowski requests city council approve name change for senior center to Lackawanna Community and Senior Center. For our city attorney, Ariana, do you want to expound on that a little bit? Why the need for the name change?
Sure. Not necessarily a need, Council President, just in conversations with the mayor. And I think we've had conversations with Kathy as well, who's the Director of Parks and Recreation. The Senior Center has had some expanded uses over more recent years. It's used beyond just the Senior Center, but used for community events, used by youth organizations, used for recreation events. So I think the thought is just that we make the name more reflective of the use that has been consistent for the center over the last few years. And it's not to curtail or take away any of the senior services that are provided there. It's just that in Lackawanna, it really is the only community center we have. So the rationale is just to make it more representative of its use and to make sure that the community is aware that it can be used for other reasons.
And does that open up the possible funding sources for us too?
That's the thought. That's what we've been told by our grant writers and others. I don't have specifics as to what grant that would, allow us to apply for, but I know that the administration is committed to the name change because I think the city really wants the broader community to be aware that it really is there for the public's use, and it's not specific to senior services.
Thank you.
May I add some color to that, Council President?
Briefly?
Briefly, yes. So CDBG funding is one of the avenues that you can apply for, and it's very competitive. So if we do not have a dedicated building that shows community center, senior center, or some combination, we're out of the mix for things like community service awards. Just this past year, there were 25 projects before the consortium, only 13 got approved. So it's very competitive. So the more targeted we can be, the better.
Thank you.
Will there be a need to update signage or letterhead, I don't know, any materials that would be reflective of this name change as well?
Yeah, I think we need to change the sign on the building.
So with
That's, I think,
and I guess
at
I'm
this
just
point.
looking to understand what money amount would have to go behind name change, not just the optics of it.
Sure, I think just the cost of the signage, which I can look into and provide the council with that information.
And are we looking to increase services for the youth, or I know you mentioned that there are a few that are already intertwined with the senior center as it is, but are we also taking initiative to increase the youth services
Yes,
or
yeah.
programs like that?
Yes, we have community organizations that already use the building for themselves. We hold our events there, as you are aware. And so yes, this will open up more avenues to be able to better utilize the building.
Cool, thank you.
Any other council members? All right, now moving on to item number 8 from the city attorney, Kwiatkowski. Request city council approve agreement between City of Lackawanna and New York State Division of Homeland Security and Emergency Services for firefighter training and authorize mayor to sign same. Again, Ariana, is there anything you need to add on that?
Just briefly, Council President, for the public's consumption, this is a contract with the New York State Division of Homeland Security and Emergency Services. It's a general contract. Anytime that the city sends firefighters to Montour Falls for training, this is part of the New York State firefighter training certification. So it's a necessary step in the process to hiring new firefighters. The city recently hired, I believe, 3. So this is just the state standard contract that they send us, and I believe we executed, the council approved, and we executed the exact same contract in July when we hired firefighters at that time.
Thank you. Any council members' comments on item number 8? Item number 9, city attorney. Request city council approve sale of city-owned property between Grant Boulevard and South Drive. There's an attached ordinance to act on the sale and transfer for same. The council members recall this had been discussed at prior meeting or meetings. In addition to that, we have our city assessor, Michael Milks, here to answer any questions. Appreciate your being here today. Mr. Mills. Ariana?
Sure, I promise these are two agendas put into one, so I'm not monopolizing one agenda. This is a project for a city-owned vacant parcel located in between Grant and South. As Council President mentioned, this is something that we brought to the council's attention in the summer. After that, we got the go-ahead from the council to pursue the project. We had a lot of public outreach. I want to thank Michael Milks, the assessor. He's done a wonderful job of evaluating the projects with all the public outreach, running the meetings, communicating with our residents. And as a result of Michael Milks's work, we have potential interest in purchasing every one of the lots that were in that parcel of land, and obviously benefits the residents because they're able to expand their property and their property value, and it benefits the city because those properties, that's now on the tax roll. So I have Michael Milks here if anyone has specific questions, but again, thank you to our city assessor.
One item is that the property was landlocked, is that correct?
Correct.
Otherwise useless unless the adjoining landowners took an interest in it.
Exactly, Council President.
Mr. Mills, anything else?
No, I was just glad that all of the lots were interested in being purchased, so I didn't want anything left unsold or unused, and they've all been gobbled up. So I'm happy about that.
Any council members have any questions of Ariana or Mr. Mills on this issue?
I'd just like to say thanks for your work on this. This has been going on for more than a year. It's been going on for like 5 years. And it's been talked about. And thank you for bringing this to commutation here.
Yeah, probably we were able to get it done. I thought relatively quickly, but
Anyone else? Now, Mr. Mills, thank you very much for your efforts, and
Thanks
we
a lot.
appreciate your being here this evening.
yeah, no problem.
Yeah, one more thing, it's city property, now we don't have to maintain it, so that's a big plus also.
And we can earn some taxes off of that too.
Yes.
Okay, very good. Anyone else? If not, moving on to item number 10 from our senior foreman, Gerken. Request City Council approve an ordinance for the budget line and transfer of funds for DPW building repairs. Senior foreman Gerken is out ill today and has to be excused. Now, there's a $220,000 grant for the DPW. It has been earmarked, he sent me a text with those items. Replacing the drainage at the garage is $90,000. Repairing the back garage wall, we're waiting currently for an estimate. Replacing the west garage door of $18,000. Remodeling the break room and supervisor office, currently waiting on estimates. Those are some of the items that are being planned for the expenditure of that those designated funds. And Ariana, I don't know if you're privy to any of this. I know, did you draw the ordinance or did Dan?
Dan did, I reviewed it,
Yeah.
but he drafted it.
Is there anything more that you want to add to that?
No, Council President, I think Dan's the best, he has the most detail on the repairs.
It's unfortunate he's out ill, but we wish him a quick recovery. Any council members have any comments? If we don't have any questions, any comments on item number 10? Now moving on to item number 11, our City Controller Jackie Dole. Request City Council approve the ordinance to move $298,883.66 back to the general fund and close the capital project. And Jackie, would you kindly inform the public as to what that all means?
Yes, the work that was done on Kirby Avenue was complete, and now we're able to transfer the money back to the general fund at this time.
And that was funded through whom? Through the county?
CDBG.
Yeah.
grant.
And so the city fronted the money and then gets reimbursed. That's what
Correct.
this is, correct?
Correct. Yep,
Thank you.
you're welcome.
Any council members have any comments or questions on item number 11? Items number 12 and 13 under communication from citizens will be taken during the general meeting. Moving on to business registrations, there are 2, 3. New number 1 kitchen, 1234 Everett Road. Linda Chen, new owner, Chinese food restaurant. Lucy Unique, INC, 1288 Electric Avenue.
Miss,
Vera Bond, new owner. Taylor Travel.
excuse me. Oh, you gotta go for
Sorry.
And Orange Buffalo, INC, doing business as Premier Rental. Larry Scrippa, new owner of rent-to-own furniture, appliances, electronics. Any council members have any comments or questions under the business registration requests? If not, I will formally call the meeting for February 2nd order. Please rise for the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Ask the city clerk to take the roll.
Maflahe? Present. Anderson?
Here.
Megan?
Here.
Sirdike? Morano?
Here.
Law Department?
Here.
Development and Marketing?
Here.
Public Works is excused, Public Safety is excused, Comptroller?
Here.
Recreation?
Here.
There are hearings from citizen Sophia Shafal. Is Sophia Shafal
Yes,
present? You're welcome to come forward and address the council.
good evening. I want to talk about how our local drug testing facility is improving the lives of people of our community, Buffalo Community Lab. When most people hear the words drug testing, they often think of rules and consequences. Drug testing is a tool for accountability, not punishment. Buffalo Clinical Lab, or BCL, promotes safety by providing accurate, reliable testing by specially trained staff. Employers can make better decisions, parents gain peace of mind, and organizations can ensure that they're meeting their own safety standards at their workplaces. Every test is a chance to save a family. Tests for early detection reduce accidents, injuries, and even help to prevent some deaths. They not only affect the person that's on the substances, but their families as well. The presence of our facility strengthens the overall well-being of our community and surrounding towns. We support public health efforts through outreach programs. For example, earlier this fall, we set up informational timetables at the local parade ground. We distributed water, school supplies, notebooks, and referrals to healthcare services and other treatment facilities. We have also started to distribute some cold weather survival backpacks to help people that are disadvantaged and that are out. Mary has what the backpack has in it. It contains emergency blanket, hand warmers, knit cap, refillable water bottle, and samples of Narcan, and some clean utensils for cooking, for eating, and providing them a little bit more safer hygiene on that. For example, I had a woman, she said to me when she came in looking for an address, she was lost. And she saw Buffalo Clinical Lab and drug testing. And she said, my fiance of 8 years needs that. She started to tell me that he's a law enforcement officer struggling with addiction despite 4 rehabilitation attempts. They attend family therapy sessions, but that doesn't seem to help. She broke down and started to cry. Her fiance's at home now, and he sleeps a lot. She watches his breathing, fearing the worst. I asked her to have a seat, and I answered to her some water so she could calm down. She was scared, she was anxious, and it's not easy for me to watch somebody struggling. I
Would
was
you
able
please
to
put that down
provide
as a
her with
distraction?
a home drug testing kit because she found bags of residue at home that she wasn't sure what was going on. I also gave her Narcan samples to at least empower her to help him should he stop breathing. She felt a little at ease knowing that she had tools to help her make a decision that she knew was coming and it wasn't going to be easy. I ended up giving her more referrals for sources, and then she promised that she would follow up in case she needed any more help. It's for her well-being as well as his and the entire family. It was a chance encounter, but hopefully one that saves a family. She thanked me for listening and offering her the tools, and then she said she would come back. The facility plays a key role in supporting recovery and accountability also. for individuals in treatment programs. Drug testing is not about punishment, it's about progress. Regular testing helps people stay accountable as they move forward toward healthier, more stable lives, and also to rebuild relationships, maintaining employment, and regaining their independence.
Amen.
Finally, the presence of this facility strengthens the overall well-being of our community. We support public health efforts, and we contribute to prevention and early intervention. When substance misuse is identified early, people can get help sooner before it escalates into emergencies, legal trouble, long-term health consequences, and death. This reduces the strain on law enforcement, healthcare systems, social services, and helps our town use resources more effectively. And lastly, our drug testing facility is not just a testing site, it's a community partner. It promotes safety, supports recovery, encourages accountability, and contributes to a healthier, more resilient town. Thank you for your time and for your continued commitment to the well-being of our community.
Thank you, Mr. Paul. We
Does anyone have any
certainly,
questions?
we certainly appreciate your efforts in our community, and obviously any help given to people who are trying to overcome the scourge of addiction is welcome and needed, and we do appreciate those efforts to that end.
All right,
And
thank you.
thank you for being here this evening.
Have a great evening, everybody. Thank you so much.
You too. Okay.
Approval of the minutes of the regular meeting of January 5th, 2026.
Morano moves to adopt minutes of regular meeting January 5th, 2026 is written.
Maflahe seconds.
Motion by Morano, second by Maflahe, to adopt minutes of the regular meeting of January 5th, 2026 as written. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. Departmental reports 1 through 5.
Morano moves to receive and file departmental reports 1 through 5 inclusive.
Maflahe seconds.
Motion by Morano, second by Maflahe, to receive and file departmental reports 1 through 5. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. Director of Development and Marketing requests the City Council approve the supporting resolution, City of Lackawanna, New York State Pro-Housing Certification Application.
Morano moves to receive and file act on resolution.
Second, Sirdike.
Motion by Morano, second by Sirdike, to receive and file act on resolution. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. A resolution approving the City of Lackawanna, New York State Pro-Housing Certification Application, moving forward to help alleviate the housing prices by adopting the Pro-Housing Community Pledge and allowing us to move forward with this project.
Morano moves to adopt resolution as written.
Second, Sirdike.
Motion by Morano, second by Sirdike, to adopt resolution as written. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. City Attorney requests the City Council approve the name change of the Lackawanna Senior Center to the Lackawanna Community and Senior Center.
Morano moves to approve requests for the name change.
Megan, second.
Motion by Morano, second by Megan, to approve request for the name change. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. City Attorney requests the City Council approve the agreement between the City of Lackawanna and the New York State Division of Homeland Security and Emergency Services for firefighter training and authorize the mayor to sign same.
Morano moves to approve agreement and authorize the mayor to sign.
Megan, second.
Motion by Morano, second by Megan, to approve the agreement and mayor to sign same. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. City Attorney requests the City Council approve the sale of city-owned property between Grant Boulevard and South Drive and act on the attached ordinances for the sale transfer of property for the following vacant lots.
For the city council, I have this listed as one item to be voted on. We could take them separately, but I don't see the necessity of that. Anybody prefer that?
No.
All right. In that instance, Morano moves to receive and file, act on ordinance.
Second, Sirdike.
Motion by Morano, second by Sirdike, to receive and file act on ordinance. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. Do you want me to read the whole thing?
I don't believe you need to.
Okay. Items 9A through 9N regarding the sale of the property to the various homeowners.
Morano moves to adopt ordinance 9A through 9N as written.
Second, Sirdike.
Motion by Morano, second by Sirdike, to adopt ordinances 9A through 9N as written. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. Senior Foreman of Public Works requests the City Council approve the ordinance for budget line and transfer of funds DPW building repairs.
Morano moves to receive, file, act on ordinance.
Anderson seconds.
Motion by Morano, second by Anderson, to receive, file, act on ordinance. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. An ordinance amending the 2025-2026 budget ordinance adopted June 9, 2025 to appropriate $220,000 from unappropriated fund balance to fund budget code DPW building repairs.
Morano moves to adopt ordinance as written.
Anderson seconds.
Motion by Morano, second by Anderson, to adopt ordinance as written. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. City Comptroller requests the City Council approve the ordinance to move $298,883.66 back to the general fund and close the capital project.
Morano moves to receive and file, act on ordinance.
Anderson seconds.
Motion by Morano, second by Anderson, to receive and file act on ordinance. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. An ordinance authorizing an interfund transfer between the general fund and the capital fund in the amount of $298,883.66 for the Kirby Avenue capital project.
Morano moves to adopt ordinance as written.
Anderson seconds.
Motion by Morano, second by Anderson, to adopt ordinance as written. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. Communications from citizens. Terrence and Francesca Gidney. Buffalo Clinical Lab requests an update on 4 items below. Status of requested allocated opioid settlement funds from 2025. Status of reserve opioid settlement funds. Request of funds from Erie County funding of $220,000. Has the settlement funding from 2026 been received?
At this point in time, I don't know if Jackie, you should answer, or Ariana. We don't, as the council members, have that information.
Sure.
Are you prepared?
Yes.
Please.
So the status of requested allocated opioid settlement funds from 2025, I think we've had conversations, at least the law department has had conversations with Mr. and Mrs. Gidney about this. Back in November, as you all know, we met and to consider a request from Buffalo Clinical Lab for opioid settlement funding that the city receives. For the public's consumption, I'm not sure if everyone in the room is aware of opioid settlement funding, but it's essentially funding that's administered through the county as a result of settlement with large opioid manufacturers. We discussed in November the possibility of providing some of the city's opioid settlement funding to Buffalo Clinical Lab. That conversation, I know that we talked about the fact that Buffalo Clinical Lab was doing all the tox screenings for Lackawanna City Court.
One function of a
Sure,
facility.
but I think that was the majority of our conversation focused on the tox screening that you were doing for Lackawanna City Court, which is, you know, a product of supporting the court's drug treatment.
Drug treatment, correct.
Yep. So we had been looking into it. I know that when we met, it was me, you, and myself, and also Assistant City Attorney Christy Cooper, who's also the prosecutor. The Assistant City Attorney has been the one who's been responsible for managing opioid settlement funding. I'll answer the questions. The status of reserve opioid settlement funds, just so everyone in the room has an idea of the amount we're talking about. Right now, Jackie, you can correct me if I'm wrong, but the city has $8,484.12 in its opioid reserve funding. So I know City of Buffalo, they get hundreds of thousands, if not millions. In Lackawanna, you know, we get much less than that. And that's,
Excuse me.
Yep.
Ariana, what was the total that we received? Do you know that?
to date. I don't know that. We could get that
I have
information.
that here.
if someone,
Well, that's okay, I'm just asking if that information.
$17,000 was allocated in 2024.
Okay, thank you, I'm gonna proceed here.
Yeah, I just wanted to, I know that you
But
were.
I'm sorry,
Oh, I'm
Ariana.
sorry.
What was the figure that's remaining in the account?
$8,484.12.
And it's my understanding that an overture was made to Buffalo Clinical for a portion of that?
That's correct, to pay outstanding invoices relative to the lab services provided to Lackawanna City Court, because that was our initial conversation. And as you know, Mr. and Mrs. Gidney, we communicated via email, and on, I believe it was January 16th, I said, I know that, you had informed our office that Buffalo Clinical Lab was no longer doing tox screenings for Lackawanna City Court, so I had requested a bit more information about the other services you provide to the community so that we could evaluate your requests under those parameters, but I have not heard back to date.
No.
But in any event, that's the status of the opioid settlement funds. I do want to make clear as well that this is a novel request for the city of Lackawanna. Our opioid settlement funds historically have been used by the Lackawanna Fire Department to purchase opioid abatement products such as defibrillators and things like that. So I think we were pretty open that it was a novel request. We would need some time. It may require city council approval if we were to allocate funds. We spent time looking at what other municipalities doing. I think Buffalo goes through a whole RFP process when they're looking at allocating opioid settlement funds, and those aren't things that we have in place right now. So we were, looking into all of those topics. With respect to the request of funds from Erie County funding of $220,000, I think I requested clarification on that. I wasn't sure if you were referencing the grant that we got from Legislator Gilmore in December. Is that?
Yes, it is. So
Okay.
I can speak more to it after you're done.
Sure.
Okay.
Yeah, no, I just
Yeah, that is-
wasn't sure if that's what you were referring to. It's my understanding that was a grant for non-capital improvements to city property, which we discussed at the meeting in December. So that's not something that we believe is available for opioid abatement purposes. And the settlement funding from 2026, we have not to date received any opioid settlement funding for 2026.
And for my own clarification, I would ask this of either Terrence or Francesca Gidney. Have you ever entered into a relationship, contractual, partnership, or otherwise, with the city of Lackawanna for opioid abatement?
No. No, we have not.
Okay, and your relationship for testing was strictly through the Lackawanna City Court?
No. We're open to the entire community. And we serve as not only drug treatment courts, but providers
Okay.
of substance abuse and addiction as well.
Okay.
So the community has received our benefits and the impact aside from drug treatment court.
Okay, but you did do drug treatment and testing for Lackawanna City?
Lackawanna, yes.
And did you establish a partnership or relationship or a contractual relationship with the state? Because the Lackawanna City Court is a state-run court. Their salaries are paid through the state. Lackawanna really doesn't have any jurisdiction or control over the city court.
No, I understand that.
Yeah.
I understand that, which is why we did speak, as I provided more detail and reference to our role in the court and what we do and the information that we have. I should not have assumed, but I did, that it was understood what our role is outside of the court, which is actually impacting the community. So if we do not ever test for the court again, what we're doing for the citizens in the community is the same thing. We're providing access to substance use disorder patients, MAT treatment. We have walk-ins simply for testing or testing supplies, such as fentanyl testing strips,
Right.
the drug testing kits. These are, and referrals to treatment for people who, unfortunately, what they've stated to us is they have nowhere else to go. If not our location, they have nothing else.
And I understand that.
Mhm.
But you're looking to the city of Lackawanna to do what for your business?
Well, we're a regulated healthcare facility, so we're asking for the city's support when funding is coming in, that we serve the entire community, not just court. So for the city, the constituents within the city, we need help to provide them with care and treatment. And if other departments or other businesses can advocate or can be advocated for, we're asking for the same thing.
Okay. And are you a not-for-profit or a for-profit entity?
Both. Our mobile, which is the Buffalo Clinical Lab, that we have our mobile sites and dispatch to different locations, that is our for-profit. What we do here in the city is our nonprofit.
And are you currently open in the city?
Absolutely. We provide testing services for employers, some factories right on Route 5.
Okay.
So we're testing the pre-employment testing and the randomized testing for them as well.
So you're doing testing for businesses in Lackawanna?
For businesses and citizens, just
Okay, and so you have a contractual or business relationship with those businesses?
in some cases, or FormBots, which is a company that is actually the main hub, and they locate a place that's close to where either a person lives or works, and then they will send a person to our location.
And I do believe in addition to that, while you're looking possibly for public funds, that the disbursement or distribution of public funds are regulated constitutionally, and the city cannot disperse funds to a profit organization or individuals. They might be able to pay some outstanding obligations that may have been generated, but those, I think, need to be approved by the law department.
But you stated that, you said for-profit, correct?
For profit.
That's why across the street, it's a non-for-profit, it's not for profit.
Is that open?
Yes, we are. Monday, Tuesday, Friday, Saturday.
Okay, because I thought there was a sign on there that was closed.
No, we're not closed. There
The
was a
sign
sign that
stated-
said we're paused for any testing for Lackawanna City Court. We're not closed. We only closed, it was a state of emergency.
Okay, all right, thank you.
And to, the question of reserve funding was not for the city's allocated amount. So when we spoke in reference to the opioid allocations, I understand what those are. I understand the amounts, it's on the tracker for that. My request was made November 12th for the reserve funding that you can contact Erie County for, to request outside funding outside of the allocated amount through the state. Every time I requested clarification on that or where we were, I hadn't received anything in response to that. And this, like I said, this was done on the 12th. So I understand where the $5,000 is coming from, what is received to the city directly. But I'd also requested funding from Erie County.
Yeah, so there's someone else, I don't know if you.
Sorry.
Oh, no, it's okay. So I remember the request, I will check with Christy, I don't believe we made a request to the county, but I know that you had offered, I think, a contact information for who you were working with there. And Christy had requested you provided, and I did not see that it came through. If you have the direct contact for the individual that you were working with, if you don't mind providing it to me and or
It would be
her.
the same process that you guys went through for the $220,000. You would have a legislator sponsor.
Sure, I thought you identified a specific person though at the
She's
county.
in opioid funding.
Yeah.
But when you're requesting outside of the allocated amount,
Mhm.
it's something that you can go through legislation for. I outlined it on the 12th when I sent over the proposal asking for this. So it's in the email from the 12th, November.
That individual's contact information.
No, the process.
Understood.
The process to obtain separate funding. It's concerning because I do understand that there's been a lot of information in reference to drug testing and drug testing for. The pause for that is because we're essentially defunded. We're a community organization serving the community, and we're not receiving the support from the city that we're asking for. We understood that pausing those services would allow our organization and facility to avoid collapse because we are now spread entirely too thin. No regulated healthcare provider is asked to sustain services on medical billing alone. This is just 2 of our employees. We have 9. And we have community outreach. We are at Say Yes on the weekends. We are working with, again, we offer the randomized testing for the factories here. This is everything that benefits the city of Lackawanna. in the face of addiction and substance abuse looks like everyone here. With that being said, when we asked for advocacy and if there could be a request made, there was a request for $220,000, but our request went unnoticed well, no one asked. Since then, we did pause services. And unfortunately, there was no alternative provided to our patients of where they could go. We're the only facility here. Our patients have nowhere to go. They're fighting for sobriety. A request is made, but it's not taken in consideration the impact that we have on people fighting for their lives here. And that's concerning to me. It's concerning to me that people who suffer from substance use disorder are part of the ADA community, which is the part of the Disability Act. They must have access to health care. I'm here, I'm in the city. If I'm defunded, people who have barriers in transportation or financial barriers, if they're not equipped due to where they may be in their phase of addiction, that is going to trigger relapse. And that's what we're here to provide. We're here to save lives. So, again, when we ask for advocacy, to simply even hear and see that other things were funded. People need to be alive to read books or to enjoy the library. These things are funded. There, you want to fund other things, but you need people to drive and be present there. Our substance abuse issue and problem in Lackawanna is bigger than anyone may know, because there hasn't been a facility here to provide anyone with the data. We had 13,000 plus visits last year alone in our city. It has nothing to do with our visits in Buffalo City Court. That is an issue that no one is addressing. And if we close, we're gonna have a public safety issue. So we're asking for advocacy. We're asking for funding. $5,000. My question is, if I don't have outstanding invoices, are we not to even receive that? Because that's the email that I got from you. Or
No, no, that's not what we're saying. I think our impression was that we would be potentially providing the opioid settlement funding for the cost associated with doing the tox screening for the courts. That's why I just asked for some more information about what you were looking to use the funding for.
Okay.
Which we can, discuss.
Okay.
But I just want to say, with respect to this grant that came in December and other funding, like funding for the library you referenced, I don't have the exact timeline, but I know that those funding requests start months and months in advance. And we met in November, and it's only the beginning of February. We had the holidays in there. I think I understand you advocating for your business, and I think the city supports it, but we do need time. We can't get a grant within a week or two.
Oh, I don't expect that at all.
So I just want to be clear that it's not a question of us advocating for the library or this instead of Buffalo Clinical Lab. I think those processes were in place months before.
We've just met in November. We've been open since 2024.
I can't speak to that, but.
So it's not anything that's new. We've offered the opportunity for everyone to visit our facility. We requested that the mayor come out and, take a tour of the facility, meet the patients. She was there for our grand opening to understand exactly what we're doing. So with even the advocacy in that way, it wasn't just the first time when you and I met. I received an award with Buffalo Business First. I invited the mayor and Chuck. No one came. That was a $600, 2 tickets were $600. No one showed up. So when you're saying there's support, it doesn't feel that way. It doesn't seem that way either.
And in regards to the $220,000 that was non-capital, when reading the FOIL request, that wasn't that long ago when you were gathering out how long it takes. That didn't take that long to get the funding, the grant from Gilmore's office.
I don't have that information. I don't know.
Being that it was non-capital, that means it goes to whatever the mayor sees fit, correct?
For city property, non-capital improvements to city property.
Does your facility actually provide treatment or just screenings?
We provide support for treatment, and we also provide treatment via telehealth. You've been to our facility
I
as
have
well.
been, and I met with you and your husband
I
for
wasn't
4
done. Hold on 1
hours.
second.
I did, I met
No,
with
I know
both of
you
you.
did. I
Yes.
said, you have been to our facility, but you were not there during our hours of operation so that you could have met or saw the patient.
I'm just asking questions for the general consumption for us to better understand what you're, A, asking for, and B, what we can provide.
I know, I
So-
just want to
So
answer
these
them
questions
clearly.
are just they're very dry in nature and they're not meant to be combative by any means.
I don't,
But I
think
just,
they are.
and I don't know if anything has changed since the last time I met with you guys. You may have expanded and unbeknownst to myself.
But
So-
when I spoke to you, you told me that you weren't the savior for African Americans community. That's what you said to me.
There were many conversations that we had.
Well, that one I
There were
remember,
many
I recall very
conversations
well.
that we had, and we don't have the space or time to acknowledge or address any of those things that we spoke with, because I'm sure
That was
they
a
wouldn't be
powerful
very,
statement.
it wouldn't be very pleasant if I were to expose any of the things that you stated.
I'm not a politician.
So we're not gonna go down that
Okay,
path.
all
I do
right.
have legitimate questions that I think
Well,
should be,
I
yes.
don't think this is progressing in a helpful manner at this point in time. I would suggest meetings after this meeting or at another time. Do you want to close with some comments to us so that we can take those away and discuss them amongst ourselves?
yes, I do. What I do want to say is that me answering is in no way, with no intent to be combative. What I want to be is clear as to timeline. That's why I spoke to the hours of operation, which is why you may not know all of the services that we provide. So that was what I want to know. What I want to also do is invite everyone to tour the facility to see exactly how we're impacting the community. I'm open to meetings. We're open to partnership with everyone, with the community, and so you know who we're helping and what we're servicing. So no, in reference to testing and testing alone, no. We're a public access to Narcan facility, which means that we have Narcan and fentanyl testing strips available to the community, and it's very discreet. They don't have to meet with us. They just can pop in. We have a place for it. Pop in, get what they need. That's something that we have. We also have referrals to treatment providers, outpatient, inpatient. We have nurse practitioners on staff that offer telehealth. So we are providing every service that we can, given the space and given the tools that we have, based on funding.
Okay. Thank you very much for being here, and I'm sure we'll have a continuing dialogue on this issue now that most of us are somewhat more up to speed on it.
Thank you.
Thank you.
Item number 12, Terrence and Francesca Gidney, Buffalo Clinical Lab, items 1 through 4.
Miranda moves to receive and file.
Anderson seconds.
Motion by Morano, second by Anderson to receive and file. Maflahe?
Yes.
Anderson? Egan? Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. John Ingram requests the City Council approve and support this year's Lackawanna Community Fun Days event. It is a 2-day event and will be held in the Lackawanna Municipal Housing Playground at 135 Odell on August 21st through the 22nd, 2026.
Good evening, everybody got their cup of coffee?
Not yet.
Couple of things, I'm just going, this is almost like it's 12-year Community Fun Day. You know what I do, we have 45 to 50 health vendors there. We provide service, we have provide stuff for the children, whatever. But mostly we provide a lot of health groups there. A lot of people help youth get jobs, help seniors. Most of you have been there, some of you, we have something special planned for this year. We have a couple of surprise people that's gonna be here, and we'll be letting you know later on down the road. What I'm acting for, what I've normally been acting for the last 13 years, for the stage, and that's it. You know what I'm saying? And I'm pretty sure that everybody welcome to come, and we hope you attend. I'm speaking fast, because I know we got 3 minutes and I need 2 minutes. I want you guys to take a look in this room back there. The people in this room, they came here specifically because they wanted y'all to see them. They want y'all to see them, what they do, how they do, about the healthcare stuff. We have no other health facility here in Lackawanna. None. So when we all know people that been using drugs, do drugs and whatever. We all know people that have passed from drugs and whatever. Your Honor, drug court was your baby. I remember watching him for 20 years, almost 20-something years he was in there.
Yeah.
And to have a facility that's right here in Lackawanna. And Ms. Jitney and them, they did a fine job, but what they didn't say, and because they're business people in the city, but I'm not a business person. I'm just a regular Joe right now. Okay? They provide service not just here, Buffalo, Lackawanna, but Lackawanna. We must have facilities here in Lackawanna. We have something that's supposed to be coming, but even if it get here, there's nothing wrong with having two. For the last couple of years, we have nothing. Now we have a chance to have something. And it behooves that we all partner up. Put aside our difference, put aside our big pants on, and just work together. We have folks that live across the street in them buildings. People are dying in here, and people don't know about it. And these drugs and fentanyl is affecting everybody, every race, creed, and color. People may not talk about it, but we know about it. Whether you're African American, Arabic, Caucasian, white, it is killing us. So we need any help we can get, we need it. So please, thank you. Y'all get together, have a meeting, cuss each other out in that meeting, but when y'all come out and do something for Lackawanna. Thank you.
Thank you, John. And John, you always do a fine job with your festival in the First Ward, and we do appreciate your efforts as always. Miranda moves to approve request refer to Public Safety and Public Works.
Are we gonna I guess edit the request, because I believe it's just for the stage, correct? You're not asking for an approval for the actual playground, because that's
I
through
think
housing.
that's housing.
That's how.
Yeah, that's housing.
But what about a bathroom facility?
We always have them in the summer already, so,
Okay.
Yeah.
so we don't need, thank you.
Take a second.
Motion by Morano, second by Megan to approve request refer to Public Safety and Public Works. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. Business registrations, new number 1 kitchen, 1234 Abbott Road, Linda Chen, new owner, Chinese food restaurant.
Miranda moves to approve business registration.
Take a second.
Motion by Morano, second by Megan to approve business registration. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. Loopsy Unique Inc., 1288 Electric Avenue, Vera Bond, new owner, tailoring and travel services.
Anderson makes a motion to approve business registration.
Miranda seconds.
Motion by Anderson, second by Morano to approve business registration. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0. Orange Buffalo Inc., DBA Premier Rental, 1268 Abbott Road, Larry Scrippa, new owner, rent-to-own furniture, appliances, and electronics.
Miranda moves to approve business registration.
Maflahe seconds.
Motion by Morano, second by Megan to approve business registration. Maflahe?
Yes.
Anderson?
Yes.
Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0.
I would ask any of the council members anything regarding tables or table items or old business. If not, Miranda moves to adjourn.
Motion by Morano, second by Anderson to adjourn meeting. Maflahe?
Yes.
Anderson? Megan?
Yes.
Sirdike?
Yes.
Morano?
Yes.
Carried 5-0.
Thanks for meeting. Thank you very much.